Approximately 1.7 million people in the U.S. live with chronic spontaneous urticaria, or CSU. Symptoms can include long-lasting hives, itching, and angioedema. In this episode of Beyond the Headlines, Dr. Payal Gupta, an allergist and immunologist in Brooklyn, New York, discusses the diagnosis of CSU and offers tips on how allergists and dermatologists can work together to identify and treat these patients.
I've been in practice for over 15 years and see a lot of chronic hive patients. And it's a disease state that I think you have to have a lot of patience for because it's something that affects a lot of people and can be a very difficult problem to diagnose. So it's a condition that a lot of people have been dealing with for a while before they get a proper diagnosis. And that's when we often see them as specialists, as allergists, immunologists, or as dermatologists.
Symptoms of CSU mimic an allergic reaction and may herald an exhaustive search for an elusive trigger, which can complicate diagnosis and treatment.
So chronic spontaneous urticaria, which is CSU, is a medical term that we use for chronic hives that have been present for greater than 6 weeks. And so these are, hives in particular are red, itchy, painful, swollen lesions that can occur anywhere on the body. It can also be accompanied by something called angioedema, which is a deeper kind of area of swelling that can occur on the lips, on the eyes, or anywhere. And it can be mistaken for other conditions, but essentially it's something that should be coming and going. It can come and go at different times of the day and with no rhyme or reason. The difficult part of chronic spontaneous urticaria is that there is no identifiable cause. And so a lot of people are frustrated and have been trying to avoid foods. They've been trying to do different things in their environment to try to get rid of these hives because oftentimes hives are kind of associated with allergic reactions. And so people think that there's something that they must be doing that are causing these hives to occur. But we know with chronic spontaneous urticaria that it isn't something that's external. It's actually an internal process that's happening. And as we get more and more information about it, we think that there might be an autoimmune process going on. So history is really key, and history and what's been happening are the key factors. So we try not to do too much testing for patients because oftentimes we can get false positive results in allergy testing. So especially for a patient that's having urticaria, if we do skin prick testing, because their skin is a little bit more sensitive, we might get some false positives and misdiagnose people with allergies that they don't have. And so really it's the relation of when someone's getting hives and looking at that in relation to what kind of testing we would do. So with inducible forms of urticaria, it's really that there should be a one-to-one correlation with what you think is inducing the urticaria. So things like pressure-induced urticaria, temperature-induced urticaria. So those kind of things, there should be a one-to-one correlation. With chronic spontaneous urticaria, there's really no rhyme or reason. It's happening at all times of the day, at all times of the night. It comes and goes and it doesn't always correlate to what, if someone thinks that they have a shrimp allergy, they haven't eaten shrimp for days and then they're getting hives, it's not the shrimp that's causing the hives. And so it's really a lot about history taking and making sure that we're paying attention to that history and only testing things that make sense to test. Because when we over-test, then what ends up happening again is that we misdiagnose people with allergies that they don't have, and that causes an additional component of stress and anxiety for the patient, because we know that food allergies can cause a lot of stress for people with just avoiding foods and having to pay attention to everything that you're eating and worrying about that constantly throughout the day. So we really don't want to misdiagnose people with food allergies and then cause like another condition on top of something that they're already dealing with.
Certain antihistamines are the first-line treatment in CSU. However, approximately 50% of people do not achieve complete control of their symptoms. The good news is that the CSU pipeline is full.
The way that we've been managing patients is with a combination of oral antihistamines, which actually doesn't work for a majority of patients. So there's over 400,000 people that we know that aren't really being managed with just the oral antihistamine option. We have another option, omalizumab, which also helps some patients, but then there's patients that also don't respond to that therapy. And that's where this unmet need that I think we're going to start seeing new therapies. The important message is that more is better in any condition, and we're starting to develop more and more therapies for this condition that really does affect a lot of people, and also that where a lot of patients aren't getting the relief that they need. So it's just an exciting time in medicine in general, always, which is why I love practicing medicine. And so I'm looking forward to all of these new treatment options that are going to slowly come out.
Novartis recently launched Spontaneous Connections, a new video series that highlights real CSU patients' experiences. The videos are available to view on neverjusthives.com.
Neverjusthives.com is a resource that is out there where, it's basically stories of patients that are dealing with chronic spontaneous urticaria and their experience with it. Because what we know is that chronic spontaneous urticaria isn't just a skin condition, it actually affects multiple components of people's lives where they're dealing with sleepless nights, they're dealing with this itch factor that is really, really difficult to deal with. And sometimes people feel alone in their condition and they feel like they may be the only ones that know what they're experiencing.
Dermatologists and allergists are often on the front lines for diagnosis and treating CSU, and collaboration between these two specialties can help improve patient outcomes.
I think that the important key message is that both dermatologists and allergists should feel comfortable referring to one another. So whether it's the allergist that's worried that they're not dealing with the right diagnosis and they need a biopsy from their dermatologist colleagues, or if it's a dermatologist that doesn't feel comfortable prescribing some of these new injectables that are coming out, then referring to your allergist colleague in order to prescribe, or if you feel that they truly do need allergy testing, to do that. So it's really that working together component in order to really achieve what we're all trying to achieve, which is better control of the disease for our patients. And that's really the ultimate goal. So it's just working together, understanding what's coming out, and working with those treatment options and working together. So I think the things that I want our practitioners to remember is that if a patient isn't responding to that antihistamine, if they're not truly getting the relief that they need, that we need to start thinking about other options, and that there are other treatment options available, and soon there'll be more. But right now, I think that it's really important for us to understand that a lot of patients are not getting the relief that they need. And one particular thing that I think practitioners oftentimes do is changing the antihistamine from one antihistamine to the other. And we know that that usually doesn't make a difference in the way that a patient actually, we know that that doesn't help. And so essentially switching from one antihistamine to another is not going to make a difference. Also, having frequent follow-up with our patients is really important, because patients are suffering with this chronic disease. Oftentimes they're not the ones that are going to come out and reach out for additional help and support, and they're just kind of silently suffering. So making sure that you're checking in with the patient, and if that's over telemedicine visit, if that's the easier way to do it, because this is a great condition to treat over telemedicine, that's great. But I think frequent check-ins to make sure that the patient's actually responding to the therapy that you're prescribing is super important in this condition, so that you can make those changes when they're necessary.
And that's a wrap. Thanks for listening to this episode of Beyond the Headlines, the official Dermatology Digest podcast. Stay tuned for new episodes dropping regularly.